for healthcare, there's several different paths that people take. You can have a clinic that's run by physicians, or it has physicians that provide services. You can have a dental clinic where you have dentists and hygienists. You can have ancillary services like podiatry, physical therapy, chiropractic, various mental health. They all have very similar needs, though, right? Every one of these clinics, and I'll distill it down to really outpatient medicine, right? So inpatient medicine, which is hospital-based, that's not what we do, right? They have their own IT, they do their own thing. Where we focus really is specializing in outpatient medical clinics, helping those clinics to become more efficient and help them with, it's all about patient volume, right? And so you have to maintain a certain amount of patient volume. You need to make sure your providers are not burning out. And as every day goes by, insurance companies and different reimbursement systems like insurance or payers, they want to drop the amount that they get paid, that they pay for these services. Patients expect higher levels of support. Any outpatient clinical is really getting squeezed from both sides, and so they have to leverage every technological advantage that's available to them. And what I'd say, every advantage in technology has many of them. So, from our standpoint, we see some real value, and I'll start with the basics, right? You should have some sort of electronic medical record that has integrated practice management. If you're not doing that yet, that's the first place to start. That's where you're going to get your clinical mastery and excellence, where you can start to process patients faster. Those systems will have integrations to different tools, like let's say the radiology system at the hospital or the lab system. So those are really, really valuable, because now your providers, albeit a physician, a dentist, whatever they are, now they're getting this information sent to them at the patient level. It's queued up, it's at their fingertips. There is no effort to go get it. So that helps reduce admin staff, right? If you're not having to manually open an envelope, scan a document, put it into a chart, or put it into a pile of paper. So electronic medical records, practice management systems, absolutely necessary. And there's so much that can be done to extend those with native integrations to systems like I talked about, radiology, lab, so forth, billing systems, insurance, payer authorization systems. So if what I've found is, although healthcare desperately needs these things, the integrations aren't always written. And so that's one thing that Sakuri does through its sister company, MSP Interfaces, is we write those kind of integrations. We also just help set up the standard integrations that come out of the box.